Welcome to the Chirotherm Training Center in Homer, Alaska.
Hey, so we're at Chirotherm here. Welcome to our reception area. As you can see, here's our front desk region as well, and that's Kim. Say hi, Kim. So yeah, this is our office. I'll show you some other components to it in a minute. We have our vibrate plates over here for our patients to vibrate on. We have our wobble chairs down this hallway, and we use the Pedibond traction right here, as you can see. Hi, I'm Dr. Piana. Welcome to Chirotherm. I'm going to show you around of our new patient procedures that we utilize for our chiropractic patients now. This is our thermography room. We use the ICI system here with our thermal camera. So our technicians or doctors are standing behind this curtain. And on the other side of the curtain, I'll show you in a second, is where the patient is standing during their examination. This here is a temperature controlled room where we keep it about 69 degrees all the time. We have a black backdrop here where the patient stands here. And we have them acclimate for about 5 to 10 minutes or until they are properly acclimated. This here is the thermal camera. This is the ICI 8640 model, which has a specific lens on it to be able to image like we do and the distances we need to use here. As you can see, there's not a great distance to save and conserve room space from the camera to the backdrop. So that's awesome. What we also do over here is we have an area for them to put their clothing out of the way so it's not in direct line of any of the imaging that we're trying to do. In our office at Chirotherm, we also have a specialized room where we have the patient on the table here with a thermal camera up here looking at them on the giant screen that we have in the room here that I'll show you. Okay, and I will show you my hand under there so you can see the thermal image. So we're able to have the patient visualize on the screen while they're laying over here. And we're able to do adjustments, dry needling, acupuncture, whatever else we do. And we have a remote control again on the ceiling to be able to do that so we can remotely watch the camera there at that point. What we do is we do our images at day 1, where we call it 0. We do it at visit 12 or at 4 weeks, depending on the patient's treatment plan. Then 24 visits or 8 weeks, and then again at 36 visits or 12 weeks, depending on treatment plan again. And so what we do is we show them a progress of 0, 12, 24, 36, or I should say either way, 4 weeks, 8 weeks, and 12 weeks. And we can show them a progression of what their results look like at that point. And I'll show you a couple of those in a minute here.
You can see from this 12-week progression how the areas of inflammation have subsided in the spinal areas. Both the patient and doctor can see changes over time over the course of treatment.
BJ was a pioneer in chiropractic and loved the art of thermography. In fact, he had the original Chirotherm, and that's where we got our name from. He certainly would be using digital thermography today and would be a pioneer with it. Join us and let's learn how to do this together to progress chiropractic into the future.
We offer a Chirotherm package that includes all equipment and training. Training can be done online and/or at our training center in Homer, AK. Find out more at www.chirotherm.com.